John Howick is a Kamloops physiotherapist. He is still on the job despite the pandemic, visiting patients via Zoom. Hi, John. Good morning.
Good morning.
How are you able to consult with and help people with physical injuries over Zoom?
It's very similar to being in the office. So it's a simple process. They get a link and they click and they join a video visit, very similar to Skype or FaceTime with someone. And then I can see them and talk to them, and I can ask them all the same questions that I would in the office. And then I can ask them to do some movements. I can assess their movement. I can often teach them how to do some of the tests that I would normally do. So instead of me resisting a movement, I'll get them to resist it themselves, or if they have a family member beside them, they could resist that movement and can find out if that's painful or if it's weak. I can even get the patient to do their own what we call palpation, so they can feel along the muscle and tell me if it's tender there or if it's tight. So we can do almost everything. Obviously, it's not the same as being in the room with them, but we can complete a very good assessment and we can give a lot of good advice. I do a lot of teaching of self-treatment. So instead of me trying to get a joint to move better, I can teach them how to do that to themselves. I can teach them how to release some of their muscles. So it's a lot of me teaching them to sort of replace me and my hands, and then we can accomplish quite a bit.
It sounds like there could be some upsides to virtually visiting your physiotherapist.
Yes, it's actually, it's been new for us, but very quickly I find that the visits are very helpful, and everyone has been very thankful to have the connection at this time. And then soon into it, that they realize how much they can gain from it, as well as often people come to see us for hands-on treatment or maybe acupuncture or dry needling, things like that, which is more us doing something to them. But now they're learning how to do it for themselves, so they can, and they can do that every day rather than once a week or once every 2 weeks where they would see us. So they can keep on top of things and potentially be able to manage things well on their own in the future.
I'm assuming that there's probably a lot of people in need of physiotherapy right now. Like there's, a lot of yard work going on, a lot of people trying sports maybe like running that they haven't done in the past.
Yes, yeah, definitely things like that. But also a big part is people not doing what they normally do. So people not going to the gym, not getting out as much, and a lot of people sitting a lot more than usual. And often, people who are working from home, or kids who are schooling from home, they're not necessarily at a proper desk, they're not at a proper workstation, maybe watching a bit more Netflix, things like that. And so people are actually sitting, which is really hard on your back, hard on your neck, and get into some poor posture habits. So we do a lot of education about those types of things.
When things go back to normal after, we start to return to our regular daily habits, can you see physiotherapy changing in any way because of COVID?
It now opens up, a virtual visit or a video visit as just another option. So Kamloops and our clinic definitely serves this whole region. And so now someone doesn't necessarily have to drive down from Clearwater to have their physiotherapy visit and then drive home. That, almost 3 hours of driving sometimes is a negative against any benefit from the treatment. So now they could, maybe they'll do some visits in clinic, some visits at home, get to see how they're functioning in their home. And so there might be times where we go, okay, I've seen you in the office. Now let's see you at home and see what you look like when you're working in the kitchen, or let's see what you look like when you're trying to do your home exercise. I think it would be very adaptable to a lot of different things. If it's a bad snow day, then we can say, we'll just connect with you over a virtual visit today. You don't have to bother driving in.
Good to talk to you. Thanks, John.
You're very welcome.
That is John Howick with Kamloops Physiotherapy. For virtual visits, you can book an appointment through